As Eyewitness News has told you in recent reports, the length of time it takes for city ambulances to respond to medical emergencies is up dramatically. Well, tonight, the Health and Hospitals Corporation, that's the parent agency of EMS, announced some major changes to try and improve that response time. Sarah Wallace explains.
Yes, Sarah. First of all, is the patient breathing or conscious?
When you call 911, you want help in a hurry. But more often than not, a city ambulance takes far longer than the 10-minute or less target time to get to you. There have been several recent cases where people have waited an hour or longer for help. In a couple of those cases, people died waiting. EMS has a number of problems. One is an outdated and inadequate ambulance fleet that should be helped by several new ambulances, which will finally arrive in the next couple of weeks. The other major issue is a human one. Emergency calls to 911 are up dramatically, and EMS staffers often work long past their 8-hour shifts, even if they don't want to. That's because up until today, HHC, EMS's parent agency, had a mandatory overtime provision. As of now, though, that has been changed to a pre-scheduled voluntary system.
We're talking about a lot of crews that are demoralized and at the same time very tired. By allowing them to pre-schedule the overtime, hopefully they'll have the opportunity to do it when it's more convenient for them, and again, when they've had a chance to recharge their batteries, to be more energetic out in the field.
To beef up a depleted workforce, HHC is also waiving the New York City requirement for EMS technicians, so candidates can be recruited from outside the city. The agency wants to hire 250 more recruits by Labor Day. Tomorrow, the Union for EMS Workers and HHC will discuss more proposals that will hopefully improve a system some have described as being in complete chaos. Everyone in this city has a stake in those talks because an emergency system in trouble is big trouble for us. From Midtown, Sarah Wallace, Channel 7 Eyewitness News.
The union says that because of the low starting pay and the very long hours, the average EMS worker stays on the job only about 2 years.